Hello and welcome back. This is Module 4. In this module, we'll discuss many of the foundational issues involved in clinical teaching. The goal of this module is for you to gain an overall understanding of both background and the underpinning issues associated with clinical teaching in the academic setting. The issues that we'll discuss in this module are related to ethics, trust, the Institute of Medicine core competencies, as well as quality and safety education for nurses, bullying, incivility, FERPA, HIPAA, social media, as well as other legal issues. By the time you finish this module, you should be able to relate the provisions of the Code of Ethics for Nurses to clinical teaching, demonstrate the characteristics of trust and relationships with students, be able to see how the NLN core competencies relate to clinical teaching, associate the IOM core competencies to clinical teaching, and be able to devise teaching strategies to ensure nursing students practice safely based on OSEN standards as well as the IOM. And then recognize personal behaviors consistent with incivility, perhaps in yourself and others. And then be able to employ behaviors consistent with FERPA. The National League for Nursing core competencies that are the basis for this module are 4 and 8. Specifically, the instructor will ensure that the curriculum reflects the institutional philosophy and mission, as well as current nursing and healthcare trends. Then in NLN core competency number 8, nurse educators are knowledgeable about the educational environment in which they practice, and they will develop networks, collaborations, and partnerships within the academic community. And finally, they will integrate the value of respect, collegiality, professionalism, and caring to build an organizational culture that fosters the development of students and teachers. In this module, the agenda will be the same as for every other module. On the next slide, I'll go over the prep work for this module. There will be some reading as well as some videos that are embedded or that you will search out to the internet for to augment your education in this module. And then finally, of course, there'll be the evaluation. Here are your activities and assignments for this module. The reading comes from Chapter 1 in your Gaberson text, the IOM Chapter 3, which is attached to the module, a very short blog post by Pennington about trust, and then finally an article by Cybele which talks about bullying in nursing education. There are 4 videos. There's one on FERPA, and you'll understand more about FERPA once you listen to that very short video. There's 2 that come from quality safety education in nursing. And then finally the one on social media. It's excellent and it's very important and pertinent to today's student, because they don't fully understand the importance of avoiding making some mistakes with social media, especially with Facebook. So we're going to talk a little bit about ethics. Both nursing and education are considered crucial professions that serve specific critical needs for the betterment of society. Our society would be extremely vulnerable if either profession failed to meet the needs of society. Teaching clinical nursing combines these 2 professions. And in thinking about our code of ethics, it calls for respect for the inherent worth and dignity and human rights of every individual, and to maintain compassion and caring relationships with colleagues. So that's both new faculty, seasoned faculty, and reinforcing this specifically is how faculty treat students with fairness. In teaching individuals to become nurses, our responsibility to society takes on a higher level of responsibility, and I call it a duality of obligation. Because here's what I mean. In healthcare or in a healthcare setting, patients are there, of course, for healthcare, and students are there for learning. And as instructors and nurses, our responsibility in our code is, of course, to do no harm. And as an instructor, we're always balancing the risk versus the benefit, always keeping the patient first. Our ultimate goal is to increase the competency of our students. So by increasing your competency and my competency as a clinical nursing instructor, we maintain our accountability to all, directly and indirectly, as our end result is to provide society with a safe, caring nurse, thereby keeping our social contract to society. We as nurse educators promise that the individuals that we add to our ranks will subscribe to the same code of ethical behavior. It is said that trust is the glue of life, and I think this phrase explains the importance of trust within relationships, depending on how much trust is in the relationship. Trust is what holds relationships together. It's the most essential ingredient in effective communications. It's the foundational principle that holds all relationships. I cannot overemphasize the importance of building and maintaining trust with your students and with everyone involved in your clinical role. Building trust with students will be your greatest ally. When students trust you, they will follow you and they will follow your direction. So I encourage you to look at the attached copy of Pennington's blog article, Trust is an Action Verb. I've attached it to the module. As with any leader, trust is essential. And to build trust as an instructor, we must follow the same rules as we set for our students, because as a leader, our actions speak. Students are looking at us and they are looking to us for leadership. They are watching us. How do we act? With them, around them, and for them. And as I've mentioned before, according to students, being a good role model is what makes us an effective clinical nursing instructor. To develop trust with our students, we must demonstrate competence. We must follow through with what we ask for and promise, be able to communicate well, get better or improve our own skills, be consistent, and to have our students' backs. Clinical instructors are competent in their clinical area, but as beginning instructors, we're not necessarily competent in our own teaching skills and strategies, and that's the reason for the course. As instructors, we need to be consistent and follow through in whatever we ask the students to do, or whatever their expectations may be that we have given to them. They need to know that they need to follow through and they need to communicate clearly. But we also need to communicate clearly. Just as we can't read their minds, they can't read our minds. And there are consequences when students do not follow through. And we know what to do in the classroom, but what do you do in the clinical area? This may be where a clinical warning may be warranted. A student may need to be sent home if they are unprepared when they arrive. They may need to be placed on a behavior contract. We as instructors need to be lifelong learners too. Role modeling, continuous learning, and improving our skills as both teachers and clinicians. And finally, we must have our students back. And here's how I interpret this. We need to support the students when they're trying a new skill. We do not belittle them when they make a mistake. Then we give them the appropriate feedback. Sometimes this is translated into allowing the student to review the steps of the procedure in a quiet, separate place before they're going into the patient's room. Or they could quickly give you the steps of the procedure in the hallway before they go into the patient's room. This means also taking a back seat while they perform the procedure, as long as the patient is not placed in any danger. Then debriefing the student in private, and then of course complimenting them and congratulating them with recognition with their peers. Additionally, we need to support our students through difficult situations in the clinical area, as well as with staff member relations, as the staff are not always or may not always be as helpful or supportive towards our students. When supporting your decisions on what is important to stress in teaching during any clinical day or rotation, the core competencies needed for healthcare professionals addressed in the Institute of Medicine report is your support. Download Chapter 3 of the Health Professions Education, A Bridge to Quality. In this report, you will find very well articulated the following recommendations. Provide patient-centered care. Work in interdisciplinary teams. Employ evidence-based practice. Apply quality improvement, and utilize informatics. I'm not saying you change the objectives of any rotation. I'm saying that these are the IOM's overarching core competencies for preparation of healthcare professionals. As you consider the emphasis of your discussions with students, the core competencies should be the underlying tenets in everything that they are doing. Maybe these are some questions that you could consider for students to ponder. How are you providing patient-centered care? What does that actually mean? Are you using the best and latest evidence for the care decisions? Are you communicating with other members of the care team? Who are the other members of the care team, specifically for the patient that you're caring for today? Are you using informatics? Are there systems in place to mitigate errors through the use of informatics? And lastly, are students learning to identify potential hazards in care delivery, possible systems errors? I have supplied the link for you to download this document, and it is attached to their resources pane as well. QSEN, or Quality and Safety Education for Nurses, shares the same core competencies as the IOM, and they add one more, safety. QSEN aims to assist nursing educators to discover effective ways to promote student learning that will prepare them for becoming full partners in the work of improving patient safety and healthcare systems. Led by a National Advisory Board and faculty, QSEN pursues strategies to build will and development effective teaching approaches to assure that future graduates develop competencies in patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Sounds like the IOM, doesn't it? I have embedded 2 QSEN videos into the course so that you can better understand the QSEN project. The website is jam-packed with learning modules and ideas for teaching, and I urge you to take advantage of this website. The first video will give you a brief introduction to the project, and the second video, which is only 16 minutes long, will talk about embedding these competencies in a beginning clinical course. I hope you found the previous QSEN module helpful. Let's shift gears and talk about the next issue, how we treat each other. Are we civil to one another? Bullying is defined as negative or abusive behavior over time, not just once and not just by physicians towards nurses. We're talking about all of us towards each other, and most specifically nurse to nurse, and how this can impact teaching students. The results of bullying in healthcare can lead to medical errors, poor patient satisfaction, adverse events, increased costs, and high attrition rates. Because when we feel ignored, humiliated, undervalued, and excluded, and receive repeated negative criticism, we quit. And this is reported by both nurses and students. The reality is that bullying in nursing and nursing education does exist. Students are all too often the target because they are at the lower end of the healthcare structure. Apparently, we have all come to accept these bullying behaviors. So in nursing education and in nursing in general, we might be actually acculturating students to accept these behaviors as normal. Clinical faculty are not regular staff members. Hence, we are often seen as the outsider on a unit. Therefore, we are placed in a position of trying to keep everybody happy in order to provide a positive learning environment for our students. And this is reality. At least this has been my reality. The truth is, we are sometimes restricting students' access to certain patients or opportunities to please the staff or physicians. I have placed 2 links on the slide for you so that you can attend webinars on this subject. Additionally, when you're confronted with bullying concerns in the clinical area, I hope you'll reach out to your mentor or other faculty for support regarding appropriate methods to deal with the stress that these experiences can cause. As frustrating as these situations can be, please remember our nursing ethics code to act with respect. And additionally, I hope you'll review that Cybele article, because she has this article is really very well written, and you can look more at her actual findings in the article about bullying in nursing. And I hope you'll also go ahead and listen to one or both of those webinars presented on the Advance website. And just a technical note, to attend the webinars that I've suggested at the Advance website, you'll probably need to register with the site. And if you haven't already done that, you'll need to do it. Both of the webinars are free. And I also would like you to check out that website because there's quite a few other resources available to you there. There are free online CEs, blogs, and forums, job information as well. And you can also sign up for a free subscription to the e-newsletter. As nurses, we're aware of HIPAA to protect the privacy of identifiable health information of patients. Students may not be so aware. So it's our responsibility to ensure that they practice with patient confidentiality in mind. In their didactic orientation, patient privacy and confidentiality is discussed. But what you might be wondering is, well, what about using protected health information in education? The answer is we may use protected health information for educational purposes as long as it is used within the teaching institution, or in other words, not at a conference. In the evaluation module, I share with you an actual example where a group of nursing students took a picture of a patient's placenta with one student in the photo, and then they posted it on Facebook. Unfortunately, the clinical instructor was aware of the photo and did not stop the students from taking or posting the picture. After it was reported to the nursing department at the university, all the students were dismissed from the program without appropriate due process, apparently, because the decision was overturned in the courts. Part of the reason was the instructor was aware, and she had not prevented the students from taking the photo, or she did not advise them not to post it or to keep the patient's confidentiality. This brings up the issue of students using cell phones during their clinical rotation. Some instructors, facilities, and programs do not allow students to use their phones in the clinical area. However, today many students and other healthcare providers have many of their resources on their phones. So it becomes extremely important for students to be aware of the potential issues and to act responsibly. Of course, as instructors, we need to also be aware of the potential concerns. FERPA, Family Educational Rights Privacy Act. The college does require that you attend a 1-hour session on FERPA, so this is just a quick review. I won't go into all the points because the following video is very short yet very succinct and goes over all the highlights of FERPA. But I do want to cover one thing with you, because you might be thinking, I don't see this as all that pertinent to me, the clinical instructor. However, it can be. The obvious issue is the completed evaluation, or maybe any other grades given during clinical. You have to remember they cannot be released to anyone except the student, unless you have written permission. However, there is one very common issue that I have been confronted with. Someone calls on the phone to the nursing unit and asks for the student, or they confirm that students are there and they pass the phone to you, the clinical instructor. What do? Discuss the possible avenues to address this with your mentor. Now that you've had the opportunity to read the articles, listen to the didactic portion, and view the videos, please take a few minutes to complete your I Will notebook and then answer the following discussion questions. Then get together with your mentor and discuss your thoughts. This module was developed with a plan to offer you an opportunity to pursue a deeper understanding of the issues that go into teaching nursing beyond the actual curriculum. And here are your questions to consider. Thank you for joining me on this module. Please don't forget, the evaluation is next. Please complete the evaluation and feedback, and don't forget to click the Submit button. Thank you, and I look forward to talking with you in the next module. Here are the references for this module.